have a 7-day rolling
Mm-hmm.
number of 50%.
Yeah, that's what it was. Is this correct? And of course, I went straight to Johns Hopkins and I took a look at it, and that is what they had. I don't know exactly how that calculation occurred. What I do know is in the same time frame, we had a bunch of recoveries removed. We had 275 recoveries removed on one day. And my thinking is those that caused Johns Hopkins data to make it look like we had a really high positivity for a 7-day moving average. As I quickly calculated it, looked at the state data for the last 7 days, and mine was not good either. 20.25% for that 7 days. 20% is 15% too high, but 48.6% is pretty scary too. No, it's 20.25%. That is still very dangerous. It means that we have a lot of spread. We aren't catching all of the positives with testing alone. We aren't contact tracing enough. We're not isolating everybody. In the same time frame, I believe it was early last week, Wapello County Public Health on their Facebook page, they had a positive that they contact trace who refused to quarantine at all or isolate. They tested positive and they basically told public health, no, you can't make me do it. Which that thought process is probably part of why we have such prevalent spread, especially in more rural areas that weren't hard hit early in the pandemic and that didn't learn the lessons that the rest of us learned. They're now having increased spread and multiple spikes every few weeks because people are having to learn the hard way. For those of us doing this work, paying attention to the data, it's very disconcerting to see more rural areas refusing to learn when we want to educate. We learned the hard way. We don't want everybody else to. Learning the hard way is what's going to happen. And it's not particularly helpful having our governor not doing press conferences, first off, but then not wearing a mask when the president came, and without a mask was throwing hats into thousands of people, some of whom wore masks, some of whom weren't. And I had a number of followers ask me, how long is it going to take before those positives show up? Because that's probably going to turn into a super spreader event. And I said, well, it's 3 to 5 days until the first symptoms show up. People probably won't get tested until about the 7th day. Hospitalizations are another 7 to 10 after that, and deaths are in about 21 days. Probably by the end of this month, we'll have a really good idea, or at least some idea of the fallout of that. But the idea that we don't wear masks in public because we're out in open air, that's not safe enough. If we all have masks both outside and inside, whenever we're around people who aren't in our family, in our family unit, we're going to be as safe as we possibly can be when we go out and about in the world. We are now at 501 hospitalizations with 122 people in ICU as of today. I predicted we were going to go over 500 about 4 days ago. Said it on my Twitter. 500 isn't too far away now. We did go up and then we went down a little, but we had a bunch of Iowans die. So they died out of ICUs. And now we're going up again. And with ever increasing positives, the percent of Iowans who are going to need hospitalization, so about 20% of positives need some type of intervention, either supplemental oxygen, dexamethasone, maybe they just need to be monitored. It's a spectrum. It's a various different treatments that are available to us. With every additional person that gets sick, our hospital systems, our clinicians, our nurses, our staff members, they're being overburdened more and more and more. And there are a number of hospitals now in Iowa, as well as just outside, like University of Nebraska Medical Center, that are either at capacity or over capacity, and they're turning people away, or they're having to redirect. We're now heading into influenza season, and we always have Iowans that get hospitalized with influenza, and a number of Iowans die from influenza. And if we put on top of all of our normal hospitalizations, and our hospital system is intended to function at capacity. That's how it works. We don't have empty beds or a ton of empty beds at all times. But if we have no beds and we have a bunch of people sick with COVID, a bunch of people sick with influenza, That makes me worry about people who have heart attack or they have chronic health problems that need regular monitoring. Like with me and my immunodeficiency, access to health care that we need in order to stay healthy is going to become decreased. So we may see a continued increase in excess deaths for other reasons outside of what we are expecting for viral spread, both with COVID and influenza this year.
What is our percent of availability in Iowa?
This morning we were at 38%. I can actually get the exact, it was 38.04% of our hospital beds are available. That's both ICU and inpatient. Our ICU availability statewide is about 600. It fluctuates a little bit. If we fill up all of our beds with COVID patients in ICUs, we're going to topple our healthcare system, and Iowans who need treatment for other things, they won't be able to get it. Whether or not we can go to nearby states, Wisconsin is not an option right now because they had to open a field hospital. I believe that Nebraska is likely soon looking at doing a field hospital as well. Minnesota is increasing. That's concerning for me on two fronts because Minnesota has historically done really well in the pandemic, but now they're seeing increased positivity. It's increasing about 100th to 200% every day. But that's a lot when a state has tens of thousands of tests. There won't be a lot of places for Iowans to go if we topple our own healthcare system. We're looking at a tragedy. If our kids go into a school, they always have a mask on and don't take it off for lunch. Or if you're going to eat lunch, go outside 10 feet away from somebody, then eat your lunch. If we do all of these things and mitigate as much risk as we possibly can and still try to maintain some version of normalcy in our lives, we won't topple our healthcare system. There are so many things we could be doing that we aren't doing. We've been screaming from the rooftops, wear a mask, social distance. We've been doing it for coming up on 8 months now, and people have stopped listening. Maybe they weren't listening in the first place, or they were listening and then they just decided to stop. And we're heading into the worst part of the year and we're not even ready yet. Maintain healthy relationships with people you care about, but stay as far away from them as possible because we need to slow this down. Staying away from other people won't just slow down COVID, it will also slow down influenza. Everything will slow. Yes, our normal lives will look a lot different, but we won't have as many deaths as we likely will if we just keep going forward as if everything is fine.
The political leadership is actually affecting how we react to a pandemic.
Our president said, don't let the virus dominate you. And then a day and a half later, our own governor said it. Definitely a very concrete action. And I did this. My husband and I sat at the dining room table and went through our ballots. And as scary as it was to drive out to Nevada and like roll down the window just enough, and we slip our ballots in, because right now we all need to vote to get rid of the people who are making the pandemic worse. Joe Biden and Kamala Harris want to help. They have ideas that are concrete that we can all do. They're following science. Our current leadership is not following science, both on the federal and the state level. We need to get rid of the people who made this worse if we want to mitigate further infection and further death. I am hoping and praying that we can, at the very least, get this administration out so we can start paying attention to science, listening to Dr. Fauci, and going with what both the CDC and the World Health Organization say. You make a bigger statement not wearing a mask about whether or not you care about other people than if you have one on. If we can get a better federal administration in, our state response will become better because Governor Reynolds will see it as politically expedient to get with the times and pay attention to science in order to save her own career. She appears to have a lack of empathy for Iowans. She used federal funds inappropriately. That's what we get from Auditor Sand's report. We need to be helping our individual families. We look at the governor making these short-term decisions that have long-term negative consequences. We're like, why would you do this? When it comes to the governor's decision-making capabilities, she really needs to either follow science and follow data. She keeps talking about having data-driven decisions, except not one of her decisions appears to be data-driven. If we all work together and we all use all of our talents, abilities, individual capabilities, we can make all of this better, and we can make it better fast. We need to care about each other. When it comes to schools, I was a little questioning as to whether or not the IDPH guidance on masks equals no quarantine would actually do something. It did spur a number of school districts to institute mask mandates. It looks like that the districts that didn't have mask mandates, they're now slowly moving in the direction of those masks. There's some indications in literature that the amount of virus you get exposed to can actually dictate how severe your disease is. So a mask is going to slow it down for the person who's got it. It's also going to probably slow it down when it hits your mask. Kids and teachers have been getting sick at an astronomical rate. That needs to slow down, especially heading into winter, because we, just like with our frontline medical workers, we don't want our whole teaching force to either end up sick, long COVID, or end up dead. We need to figure out how to do this so that the smallest number of Iowans get the virus so we can get to that vaccine. And then all of our kids are safe, and all our teachers are safe, and we're all safe, and we get to have a party. We need to learn now so that we have all of the tools in place in our own memories, but also in our social memory, to then approach the next pandemic and not have it do what it's doing to us now. We need to use this information. We need to learn from it. We need to grow. And a lot of that is empathy. A lot of it is empathy. I'm hoping we don't see a major tragedy in Iowa this winter.
Yeah.
Like I'm hoping that influenza just turns out to not be a thing this year. That's what I'm praying for, because I'm like, then it's only COVID, but
yeah,
I don't want it to be that either.
Yeah. Take
Take
care.
it easy, stay safe.
All right. Bye-bye.